Evan McMorris-Santoro reporting there. Well, Dr. Georges C. Benjamin is Executive Director at the American Public Health Association. He joins us now for more insight on all of this. Dr. Benjamin, here in the United States, the CDC is urging the reopening of schools with some guidelines. What can you tell us?
Well, listen, thank you very much for having me. Yes, the CDC is absolutely trying to get our kids back in school. And they're trying to balance this issue around the infection with all the other challenges that happen to kids when they're not in school. But this is good guidance, and we're hoping that people will be able to follow it. I think the essential part of this, of course, remains the amount of infection that's in the community, because that drives what schools are ultimately able to do and how safe you can be.
Children, going back to schools, children have not been inoculated. They're not part of the vaccination process largely overall. That's because they weren't included in any of the trials. I understand that's about to change.
Yes, interestingly enough, there has not been a lot of infection in the schools, and kids don't seem to be that terribly infectious. Nonetheless, they need to be vaccinated. And we now see that the AstraZeneca folks are going to bring down their studies down to age 6. And hopefully, if those studies work out, we'll be able to vaccinate kids by the beginning of the summer.
I want to talk about the workers who have been affected by COVID. As we know, across the world, COVID has really exposed or highlighted some of the inequities in various countries and really reinforced them. And here in the United States, it's often come down to the burden on the working class. And I understand that workers are being denied workers' comp claims over COVID. What are you hearing about that, and how is that affecting the working population?
Well, that becomes one of the many barriers, because the big debate is, where do you get infected? And of course, in many cases, when you had to go to work, you were going to be exposed to someone who's infectious. In some places like meatpacking plants or places where people are working very close to one another, and we've had outbreaks, it's not a question about whether they got infected. But in many other cases, of course, it is a question about whether or not you got infected, if you're in a bar or at a grocery store. And the truth of the matter is that we need to take care of everyone, regardless of where they got infected.
The Biden administration has definitely upped the federal response to vaccinations. We've seen that across the board. It's also promised to tackle some of the racial inequalities and inequity in addressing vaccination. Has that changed in the last few weeks?
The Biden administration has taken this full on. They've named a task force to look at some of the structural inequities that we're having. But they've also started doing some of the things that we already know work, such as putting some of these vaccination sites in communities where people are disproportionately impacted. And Los Angeles is an excellent example of where they've begun doing that.